Previously on City of Angels.
We are the rightful, if illegitimate, heir to the throne of England.
How long has the right leg been that bad?
More than a fortnight. It doth pain us greatly, as doth the left leg, though there be no lesion on it.
There's a pretty good chance you're going to need to have an operation.
No. The royal person must remain intact.
Do you like to dance?
Okay, I admit I do love dancing. That was one of the things that drove me crazy
With Dr. Turner.
Now, if Ben didn't like to dance, we never went.
So go tonight with me.
Get out of here.
How are you doing, Michelle? Is the pain any better?
A little. Did the ultrasound test show anything?
Nothing definite. So it's not really sore when I press?
Not really. More like uncomfortable. What do you think is wrong with me?
Well, I don't think it's appendicitis. You've got a few white cells in your urine, so it could be a mild infection or it might just be something you ate.
I ate sushi last night.
Well, it could be that. Are you hungry now? It's almost breakfast time.
I think I could eat something. Does that mean I can go home?
Up to you.
I'd love to go. I have a 10 o'clock class.
Okay. I'm going to give you some oral antibiotics. I want you to come back if you don't feel better in the next few days.
It's Dr. Williams.
Yeah. I'm sending her home.
You're not going to check with your attending first?
She doesn't localize. Her white count is top end of normal.
With a left shift.
A mild left shift, normal ultrasound. She's got a few cells in the urine, which I sent for a culture, and I'm giving her Cipro.
I don't know. She looks sick.
A urinary infection will do that.
Your call?
Thank you.
Sir? Wait a minute. You just can't come in.
Supervisor Ed O'Malley has been injured.
Come on this way. What happened to him?
Got mugged.
Come on to the bed here.
Hey, could you wait outside, please?
No, I stay here.
Mr. O'Malley, I'm Dr. Williams. This is Dr. Roberts. Mr. O'Malley.
Breath sounds diminished.
152 over 93, pulse 111.
Not sure about the airway. Can you speak to me? Mr. O'Malley.
Call Ben Turner. I'll only talk to him. I was working late for this morning's budget meeting, and I decided to walk over to Louis and have some late-night French toast.
Where was the big guy?
I sent him home earlier. I don't inflict my work hours on my employees.
So you walked through downtown at 3 a.m. alone. You're a braver man than I, Mr. O'Malley.
Not as virile, though. Had I been, you'd be patching up the little bastard's jump. Hey, what's the damage?
A rib fracture on the right side. But the head and facial CT scans are normal.
Essentially a clean bill.
Well, essentially. But I'd like to admit you to the hospital for at least 24 hours. Let the swelling come down and make sure there aren't any other injuries.
You'll find nothing. beyond a bruised ego that's best treated as an outpatient.
You'll be needing some follow-up.
I'll call my internist.
Nice shirt.
Selka. We all set?
I guess so. Unless you want to make a police report. I can arrange for that right here.
Pointless. I didn't see their faces. Besides, who needs all that press?
All right.
Dodger fan, Doctor?
Sure.
I'm going to see you watch the next game from the owner's box. Thanks again.
Okay.
Kept his clothes off and clean for a man who got beat so bad.
Hey, that's his story. Whether or not it's the story, I don't know.
You want anything from the coffee corner?
No, thanks.
You should all read about the well baby exam.
Hey there.
And then we'll evaluate some patients in clinic. We'll see you next week.
Why the cold shoulder?
That was a group of first-year medical students.
So what?
So there's such a thing as professional etiquette?
All I said was, hey there. I didn't say want to go to Paris for the weekend.
Wesley, this is a major teaching hospital where I'm assistant professor of pediatrics. It's not a summer camp.
Okay.
All I'm saying is be discreet. Our relationship is a private thing. It needs to stay that way.
So a full-page ad in the LA Times is out of the question.
I just don't care to be the subject of idle gossip.
My lips are sealed.
But think of it as a form of chivalry.
Admiration from afar. I can do that.
Thank you.
Kiss goodbye? Just kidding. See you later. Top of the morning.
What have you been smoking?
Hey, who are you running to?
Scout's phone with my ex-husband. He wants to meet for breakfast.
Any particular reason?
He said he was in town for the day and he liked to talk. Guess I'll find out.
So, he just calls out of the blue and off you run?
My morning freed up, but I'll admit he's got my curiosity.
I'll be here to beg you to come back to him.
Ooh, you're not worried, are you?
Should I be?
Well, let's see. My ex-husband is treating me to breakfast at a very nice restaurant while the love of my life can't scramble an egg. Now, what could there possibly be to worry about? See ya.
Street guy took a beating. Assorted cuts and abrasions, and he's been exposed all night. Another street guy found him in an alley.
How you doing, Your Highness?
Cold, shivering, bone.
Get the woman blankets, warm up the IV fluids.
1, 2, 3.
Did a vascular workup on this guy's legs last week. Right leg's gangrenous and the left isn't too far behind. He bolted on us when we told him we'd probably have to amputate. You know him too?
I've seen him since I was a resident. What else has he got?
Diabetes, hypertension, renal insufficiency. Real house of cards.
BP is 172/95. I was going to say he's disoriented, calling himself the King of England, but you are too, so.
We'll get him a CT anyway. Can you tell me what happened, Your Highness?
The Gauls, a midnight sneak attack. We responded bravely, but the invaders were too many and too strong.
Nasty bump.
Our coffers are pillaged, our sanctuary breached. We are in total ruin. Good day to thee.
How's it going, Your Majesty?
Not well, not well, not well.
Going down to radiology, Your Highness, and Dr. Jackson will meet you down there. And then we're going to have to talk about your legs.
Good squire, and we shall have obtained some modicum of strength. We do request a private audience with thee and thy footman to discuss my infirmities.
Of course.
Bear me up. Give me my crown and scepter. For meritorious service to thy king, I do anoint thee Knight of the Grand Cross. I willingly place my life into your hands. Bear us away.
Smell.
You all right, Dr. Turner?
10 years I've known him. He's never knighted me.
Does this mean I have to call you, sir?
Always call me sir. When he's done a CT, sees Brock to the short stay room. It's more comfortable.
Will do, sir.
Michael,
Lillian, it's wonderful to see you.
it's been a long time.
2 years. Sit, please.
Still getting over the fact you called.
Well, I'm scheduled to speak at a corporate law symposium today, so I decided to fly down early. See if we couldn't get caught up. Thank you. So, medical director at Angels of Mercy. It's very impressive.
Keeps me busy. And you? Obviously still doing corporate law.
Well, I've downscaled the operation quite a bit, but yeah, it's still going strong.
I have to say, you look great, Michael. You working out?
Every day. Yoga, I swim twice a week.
Doesn't sound like the man I used to know.
Well, there've been a lot of changes, Lillian. I've stopped drinking. Been in AA 18 months.
Congratulations. I knew you could do it.
Well, I wish I had done it sooner. It would have spared us both a lot of pain.
That's the past.
I still need to make amends to you, Lillian. It's part of the program. It's the reason I called.
You don't have to do this, Michael.
Yeah, I do.
Okay. Fire away.
I tell you what, why don't we have breakfast first? That way I can kind of ease you into it. And in the meantime, what have you been up to?
Work. And more work. Hospital. I don't think either one of us was expecting it, at least not consciously, but we're back together and we're very much in love.
I'm glad. Glad to see you so happy.
What about you? Have you found someone?
I have. Changed my life.
She must be very special.
To change me in ways that you couldn't? Is that what you were thinking? Don't do that. You were the most perfect wife that a man could ever ask for. The problem with our relationship was that I was drowning myself in alcohol and drugs, trying to deny a simple truth. Sitting down? Lillian, I'm gay. I told you here in the restaurant because I didn't think it was fair to drop it on you at work.
Never even occurred to me.
Why should it? I had an image to keep up. Married, successful lawyer.
Did you come out to the firm?
I told the partners. And about 3 months later, I left the firm. Not in so many words, but they let me know I no longer fit their mold.
I'm sorry.
No, Lillian, I'm sorry. I'm sorry for treating you so poorly. And I'm sorry for lying to you for so long.
Consider yourself forgiven. Good for you. You're showing a lot of courage.
Well, credit Mark. If it hadn't been for him, I never would have found the courage to face you.
I'm glad you did. For both our sakes.
When we first got together, Mark and I, we insisted that before we became intimate, that both of us be tested.
Tested for HIV?
Yes.
And?
And I tested positive.
Ooh. Talk about wasting good food on bad news.
Lillian, have you been tested?
What do you mean, have I been tested? Don't tell me.
to.
You screwed men while we were married. You put me at risk.
Lillian,
You son of a bitch.
I'm sorry.
Well then, that just makes it all okay. Doesn't it?
Dr. Price, haven't seen you up here since Jaco. Thank God that's over.
I'm with you there. Nancy, the hospital's treating someone under an assumed name for security purposes. And I need you to run a blood test on the quiet and get me the results back today. Can you do that?
Well, what are we checking for?
HIV, and I'd appreciate it if you put a rush on it.
I'll make it a rush John Doe, and I'll walk it through myself. I'll call you as soon as the results are in.
Thank you. Thanks a lot.
Your Highness, how you feeling?
Ancient, good Sir Knight. How were the scans?
Your CT scans are normal, but the real problem is your legs.
Aye. They revolt against us worse than the Gauls of yesternight.
And given you much worse from last week, the revolt is progressing at a pretty alarming rate.
Just from the looks of them, I'd say they're both going to have to be amputated.
Nay, the King of England will not be halved.
Your Highness, if we don't take your legs, you're going to get septic and die. That's a guarantee.
You guarantee us death, good Sir Knight. It was guaranteed from birth.
Of course it was, but it doesn't have to come this soon. If we do this now, you may have years left.
Last night's attack proved our frailty. Our time on Earth is done.
That's not true.
Aye, it is. That's why we ask this audience to beg of thee, warm bed, the company of our kinsmen, and at the appointed time, a sip of hemlock, as chariot to the only kingdom greater than our own.
Are you asking to be euthanized, Your Highness?
Bright lad.
I can't do that.
You would refuse an order from your king?
Your Highness, I don't mean to be disrespectful, but putting folks to death, that's not what we do here.
No, you cut them in half and send them on their way.
No, sir. After the surgery, we'd send you to a rehabilitation facility. They'd fit you with prosthetics and give you physical therapy.
Then send me where? Home? Our home is pillaged, plundered. The dukes and earls, once loyal to our cause, are dead and dying. The very streets of England are hostile to her king. Nay, sir, we are not long for this world. Without the horrendous surgery, how much sand is left in the hourglass?
Perhaps 2 weeks' worth. 2.5.
For that, we would accept a warm bed and soothing unguents.
Your Highness, I don't know if I can provide that.
Thou hast not failed me yet, but this is the most important mission of all.
I understand. I understand. I'll try my best.
Don't try, good Sir Knight. Do.
I can't stand that phrase. My dad uses it.
So did mine.
You want me to park this guy in the ICU for 3 weeks?
You could put him on the ward.
Rotten legs tend to stink, Ben. He'd need to be isolated. You know that.
I can't send him to a nursing home or a hospice. He's not a veteran. I'm asking you to cut me some slack, Ron.
I get 15 doctors a day in here asking for slack, Ben. I tell them the same things I'm telling you. Unless he consents to surgery, he's out of luck.
I can't put him back out on the street. He'll jump off an overpass, or he'll step in front of a bus, or he'll freeze to death.
Quick and cost-effective.
So, you'll pay to cut off his legs, but you won't let me keep him comfortable till he dies.
We're an acute care teaching hospital, doctor, not a custodial facility. Treat him or kick him?
He's a good old man, Ron. I took out his gallbladder, did a hernia repair on him, I drained abscesses in his feet. I went to school on him.
You keep him here, Ben. I'll smell him a mile away.
Thanks a lot for your help.
Door's always open, Ben. Always open.
Yeah.
Patient's in 4A, Michelle Ling. She's got acute abdominal pain.
She presented earlier this morning?
I worked her up, gave her Cipro, and sent her home.
Guess it didn't do the trick. Hi, Michelle. I'm Dr. Ben Turner. Do you have some pain in your abdomen?
It hurts real bad now.
Okay, I'm gonna have to feel your stomach. Just very gently, okay? Okay, I'm sorry. I won't do it again. You have peritonitis, Miss Ling. It's probably a perforated appendix. We need to operate as soon as we can get a room.
Anything to get rid of his pain.
Yeah, the nurse is gonna give you something right now. All right? One of your time, please. Why didn't you call me about her this morning? You mentioned it when I came in to see O'Malley?
I did a complete workup. I didn't think she had anything, and I didn't want to bother you.
Did you consider retrocecal appendicitis?
Yes, but her exam and lab tests didn't support that diagnosis.
Wow, that's what she has, Wesley. And now it's perforated. Do you know the potential complications of free peritonitis in a young female? Bowel obstruction, abscess, infertility?
I made a mistake. It won't happen again.
Drill is you call me. You're not sure? You call. You're positive? You call. So you don't end up with a disaster like that.
I understand, Dr. Turner, and I said it wouldn't happen again.
Hey, don't take that tone with me, Wesley.
I don't mean to take a tone, Dr. Turner, but I did the appropriate workup of a patient with acute abdominal pain. I drew a conclusion that may have been incorrect. If so, I'll learn from my error.
There is no if here, doctor.
You see the way you're coming down on me? I just have to wonder if this has anything to do with something else.
Like what? Like what, Wesley?
Like the fact that you pissed off on dating anti-facts.
I didn't know you were dating anti-facts. I don't care who you date, but that you think it's appropriate to question any instruction from me for whatever reason in the face of a patient you egregiously misdiagnosed is appalling.
If I was out of line, I'd
go make sure Miss Ling is pre-op, then get her up to the OR.
Dr. Calza, I see you north of 4. Dr. Calza, I see you north of 4, please.
We'll need a 12mm trocar along with a 10 and a 5. I think we ought to start with the Hassan, just to be safe.
You ready, Dr. Williams?
Hey, Weiss, can you hold the camera for us?
Nothing would make me happier.
We don't need you to scrub in, Weiss. You can watch on the monitor if you want to.
Just thought it'd be easier for you to assist me if we had Weiss on the camera.
Well, you thought wrong, because it's going to be you assisting me on this case.
Is this no longer a second-year case?
Not today, it is. Go on over there and put on the drapes. I'll take endoloops for the appendix. Got a lot of irrigation. Move down.
Dr. Turner.
Wesley, let me give you a little bit of advice here. Use this opportunity to practice holding the instruments and keeping your mouth shut. Varese needle.
Come in. Ben.
Wesley Williams tells me you've been dating.
We're hardly dating. We've gone out a few times.
I still would have appreciated hearing it from you to avoid the sucker punch I just got in the ER.
He announced this to the ER?
No, it was in private. Off a legitimate reprimand, he accuses me of attacking him out of jealousy.
What? You could fire him.
The thought crossed my mind. Are you crazy, Anna? Dating a resident?
You're dating the medical director?
You don't see the difference.
I'll take care of this.
Anna, maybe we need to talk.
We just did, Doctor. Now, if you'll please excuse me.
These are antibiotics. Make sure you take all of them and call me if you have any problem.
Thank you, doctor.
I stitched up the hand laceration. Can you cover me for 10 minutes?
Yeah, all things together.
Anyone's asking, I'm up in peds.
Anonymous 911. Mid-20s male, severely beaten.
Damn.
Diffuse facial trauma. Deformities of the right arm and both legs. He was left behind a dumpster.
On my count. 1, 2, 3.
Name's Sanchez. Severely beaten is the understatement of the month. This looks like a professional job. You'll let us know when we can talk to him?
Sure thing. We need to find someplace to put in some lines and then type and cross them for 6.
Decreased breath sounds.
Left femur's broken.
Blood pressure is 143/96, pulse 120.
You got the sat monitor hooked up?
Saturation 91%.
6 liters O2 by mask. I think he's got a Lafort. Show me your teeth, sir. Probably got a mandibular fracture, too. Open your eyes just a little bit more, please.
He's starting to have some ventricular ectopy on the monitor.
Right tip fifth fracture. Probably hypoxemia, but have lidocaine ready.
Trepidation and deformity of the right wrist.
So we need ortho and ENT after we get his x-rays and CT scans.
Start a subclavian line, too. I need a central line with a cordis introducer. Let's do a chest x-ray first.
Saturation's a little better.
Weiss, could you...
Yeah, go ahead, I got it. Okay, I want to run 2 liters of ringers through the cordis. Try starting a left.
You got a minute?
Sure. Turner talked to you, didn't he? Anna, I was trying to come see you, but the ER got busy and
You and I can't see each other outside of the hospital again.
That's pretty drastic, isn't it?
It's actually totally appropriate.
I promise you, Anna, this is the worst it'll get. If we can weather this, we can weather anything.
Wesley, you're a resident. Your purpose here is to learn not only surgery, but the maturity to be a good doctor. And today, you proved that you're way too easily distracted.
I can work on it.
I'm sorry. It's over.
I'm sorry if I caused you any embarrassment.
You're a wonderful guy, Wesley, and you're going to be a great surgeon. But the road there is hard enough as it is. You don't need me making it harder.
It's kind of thee to pardon us our stench.
That's all right, Your Highness. Dr. Creighton, Dr. Turner.
Dr. Jackson. Hello there. My name is Dr. Cynthia Creighton. I'm a psychiatrist. Mr. Charles?
Mister, we do forgive thee thy youthful impertinence, but madam, we are not amused.
I understand that you prefer Your Highness or Your Majesty, but for the purpose of this meeting, it's going to have to be Mr. Charles or Henry.
Prithee, good Sir Knight, what is the purpose of this meeting?
He just wants to ask you a few questions, Your Highness.
Proceed, but briefly.
Would you tell me your name, sir?
'Tis no secret we are Henry, King of England.
Do you know where you are?
At our castle.
Do you know what day it is?
Thy face is most familiar. Prithee, from whither dost thou hail?
Riverside. Mr. Charles, do you know what day it is?
Evidently, the day of our deliverance. Rejoice, good Sir Knight. It is the fair princess, returned from France to liberate the king.
No, Mr. Charles. I'm a psychiatrist.
An excellent disguise, dear daughter. Make thee some row. We shall escape beneath it.
Do you ever hear voices in your head?
Aye. A child lost us these past 10 years, but now returned again to liberate a long-imprisoned father.
Your Highness, I think you ought to take this a little more seriously.
Oh, fear not, Sir Knight. We set before thee a perfect picture of the liberation. Make thee some row.
Mr. Charles, are you aware that you have a life-threatening illness?
Not so, not so. 'Tis part of our disguise.
But surely these good gentlemen did explain to you about your legs, didn't they?
A ruse to appease a nation bemourning a captured king. Now, hard upon the stroke of midnight, a horn will sound, signaling thee to storm the battlements. To who? To who? Till then, God save the king! To who? To who? To who?
Thank you.
What do you think?
He's delusional, there's no doubt there.
You see any of that as him playing with you?
I absolutely did. I wouldn't consider him incompetent on the basis of the persona alone.
This was a competency test?
Which he failed by virtue of not understanding he has a life-threatening illness.
But he does understand. Didn't he acknowledge it this morning?
Think we need to get the courts involved?
Since it's a life-threatening situation, I think we can proceed without appointing a conservator.
Great.
Dr. Turner, are you saying you're going to cut this man's legs off against his wishes?
Trying to save his life, Arthur.
He doesn't want that. He wants to die.
And I'd happily let him die with dignity, but that's not an option. And we treat him or we put him back out on the street, where he'll kill himself or somebody else will. But if we do the amputation, then he'll live out the rest of his life in rehab. Safe and warm.
Halved.
Unfortunately, yes.
A simple injection could solve everything.
It's not an option.
It's merciful.
It's murder. If the only way I can keep him in the hospital is by extending his life, then that's what I'm going to do.
Dr. Price, Nancy Wong from the lab.
Send her in.
Hey, we finished early, so I thought I'd bring it to you myself.
Thank you, Nancy.
Want some company?
You don't ask me about Michelle Ling's operation.
I heard it was appendicitis.
I think you knew that at 4 a.m. I should have just kept her. Typical arrogant surgeon. You gonna put my picture up in the ER? Warning may be dangerous.
We all make mistakes.
Except for Ben Turner.
I'll bet he made the same mistake when he was in training.
Guess I'd feel a lot better if I knew that was true. What really made me feel better is if I could just get a handle on making such bonehead mistakes around him.
How do you expect to learn if you don't make mistakes?
Yeah, but when he pounds me, I feel like he's trying to send a message like, this isn't working out, Wesley. You're not good enough, Wesley.
Dr. Turner's pretty straightforward. If he thought that you were no good, I think he'd just tell you.
So it's all in my head.
I don't know. I'm not around you all the time. But when I have been around you, I've seen you do fine work.
Except for this morning.
Well, you know what they say. Good judgment comes from experience. Experience comes from bad judgment.
Yeah. Well, given that, I should be a wizened old man by now.
What you should be is not feeling so sorry for yourself. Anyway, my roommates and I are having a little get-together next Saturday. We hope that you and Dr. Syphax might want to stop by.
You knew about that?
Wesley, everybody knows everything.
Well, I'd love to come, but Anna Syphax you'll have to invite separately.
Oh, yeah?
Oh, yeah.
Okay, then. Saturday, about 8. And I think I'll forget about inviting Dr. Syphax.
You want me to bake something?
You bake?
About as well as I diagnose appendicitis.
Dr. Creighton's already written her note. She'll be ready in a couple of hours.
Hey,
Hey, yourself. Where you going?
I had to find you. See if you're doing anything for dinner.
I just scheduled surgery for 8 o'clock.
Are you up to it? You look tired.
Long, bad day.
Sorry to hear that.
So that was your breakfast?
It was okay. What's your surgery tonight?
Double amputation on a homeless guy who thinks he's the king of England. Why?
Just wanted to see when you'd be through.
Okay, what's on your mind? Something happened at this breakfast?
No, it was fine. Michael's in AA, and he wanted to see me so he could make amends.
What does he have to amend for?
Being an alcoholic, lying about it. Yes, it was pretty standard stuff, but I've never been amended to before.
You sure that's all of it? stat page from the short stay room. It's got to be about his sinus surgery.
Go ahead. I'll see you tomorrow.
Sure you're okay? You got me worried now.
I am fine. Go.
Dr. Norton, please call extension 4195. Dr. Norton, please call extension 4195.
So,
Dr. Turner, he's gone.
what? He just up and went, Loretta? Man can barely walk.
I don't know how he could have done or even when.
Call security. We'll go find him. He could have gone far.
Watch the door. My God, Mickey, you look awful. I brought you some flowers. No need to thank me. Poor boy. You don't want to move that jaw too much. You picked the wrong man to mess with last night. Study this face, Mickey. Because if you ever see it again, you are a dead man.
Yes. Thought you'd be back in Oakland by now.
Couldn't leave. Had to come back and see you again, see if everything was okay.
My HIV test came back. It was negative.
Thank God you are fine.
I am not fine. I am angry as hell.
And you have every right to be.
Oh, for God's sake, Michael, don't give me that patronizing, passive-aggressive crap.
What do you want me to say, Lillian? What do you want me to do?
It's not what I want you to do. It's what I wish you hadn't done. I wish you hadn't lied to me. I wish you hadn't put my life at risk. I wish you hadn't been such a coward.
Well, me too. But unlike you, I've got to live with the consequences of what I've done for the rest of my life.
Oh, so I'm suddenly supposed to feel sorry for you?
I don't want your pity, Lillian. I was hoping I could count on your understanding.
Oh, I understand. I understand we got an AIDS clinic across the street that treats black women all day long who weren't as lucky as I was. Who were infected with HIV by men just like you. Who don't have the courage to admit what they're doing and who are still in denial even while they're killing us.
If black men are in denial, it's because when we reach out for help and understanding, we get ostracized and ridiculed. When I finally got up enough courage to tell my folks, my father told me I was no longer his son, while my mother cried about lost grandchildren. I was thrown out of my church. Friends of mine, good black friends who I'd had for years, suddenly lost my phone number, while my law firm slowly poisoned my name in the legal community. Lillian, if I could somehow magically take away all the hurt and damage that I've done, I would gladly give up my life right now, but I can't. All I can do is stand up, try to be a man, make amends, and then get on with my life.
Who's your doctor up north?
Harriet Diego, Oakland Memorial.
I know Harriet. She's excellent.
My flight leaves in an hour.
Thank you for giving me the heads up.
best to you.
Michael, I wish you strength and health and all the love that your heart can hold. Consider us amended. Okay?
Thank you, Lillian. Thank you.
Dr. Turner, there's a guy going nuts in the street. Sounds like the guy you called us about.
Now is all weed. Now, hush. Listen. Listen. Round this block.
There he is, Doc. Right up there. Help me out here.
Watch out, he says he has a gun.
Release. Hey, turn around. We just want to talk. Release. Turn around slowly so we can see your hands. Don't shoot. Let us go tonight. Gun!
He reached like it was a gun.
Call an ambulance.
It's a cane. Why'd he pull it like that?
Kid, call an ambulance.
Come on, John.
You're gonna be okay, Your Highness. You hear me? You're gonna be okay.
No, Doc. Come close. It's done. It's finished. I finally got the state to do its job.
You quit on me. I'm not gonna quit on you. Don't you quit on me either.
Oh, no, stop it. Now, you listen. Listen to what I got to say. You'll never be the doctor you can be until you accept my right to die is not your failure. You hear what I'm saying?
I hear you.
And tell the officer who shot me he was right. I'm sorry it had to be him. I have a daughter in Dayton, Jennifer Charles. Married name is Michaels. Tell her I'm gone. His life was gentle, and the elements so mixed in him that nature could stand up and say to all the world, this was a man. To